Today, we're going to talk about something that millions of people live with, a lot of times in silence. It's called Generalized Anxiety Disorder, or GAD for short. We're going to break down what it is, what it feels like, and most importantly, that there are ways to manage it.
So, have you ever had that feeling? Where your mind is just stuck in overdrive, racing about work, or your health, or your family, even when logically you know things are okay. If that sounds even a little familiar, you are definitely not alone. That feeling is right at the heart of what it's like to live with GAD.
So a lot of us feel that racing mind from time to time. But when does it actually cross the line from normal, everyday worry into a real clinical condition? Let's take a look at the official definition to see what really sets GAD apart.
Okay, there are three really crucial words in this definition that separate GAD from regular stress: excessive, persistent, and uncontrollable. So we're not just talking about being nervous before a big meeting. This is a constant state of worry about all kinds of different things, and it happens day in and day out for at least 6 months. That long duration is a really key piece of the puzzle.
And it's way more common than most people think. It affects about 2 to 3% of adults every single year. And, interestingly, as you can see here, it's diagnosed about twice as often in women as it is in men. But honestly, the most important thing to know about GAD isn't on this chart. It is absolutely treatable. And the first step is just understanding the symptoms.
Right, so GAD is not just all in your head. Not at all. It's a full-body experience. Being in that constant state of high alert really takes a toll, and it creates this whole cascade of symptoms that are both psychological and physical. Let's break those down.
So mentally, that worry can feel like it takes over everything. And we're not just talking about the big stuff. People with GAD often feel a huge amount of distress over really minor things, like getting chores done or being 5 minutes late. It can also make you feel constantly on edge, irritable, and make it almost impossible to concentrate on anything.
And this is where you can really see how all that mental strain shows up in the body. It has to go somewhere, right? That constant worry leads to tense muscles, this feeling of restlessness where you just can't get comfortable, and just deep fatigue. And it's no surprise, sleep is often one of the first things to go, either trouble falling asleep or waking up in the middle of the night.
So, with all this going on, how do doctors get a handle on it? Well, they often use a really simple but super effective screening tool called the GAD-7. It's basically a 7-question scale that helps measure just how severe the anxiety is. A score from 5 to 9 might suggest mild anxiety, while a score of 15 or more points to severe symptoms.
Okay, so a screening tool like the GAD-7 is a great snapshot, but getting a formal diagnosis is, a more thorough process. Let's walk through the official criteria so you can see what's actually involved.
So, the official diagnosis basically follows a kind of checklist. First 2 steps: confirm that the worry is long-term, that 6-month mark again, and that it feels out of your control. Step 3 is about connecting that worry to at least 3 of those physical symptoms we talked about, like fatigue or muscle tension. But step 4, this is the real clincher. The symptoms have to be bad enough that they're causing real distress or getting in the way of your actual life, your job, your relationships, just your overall well-being.
And of course, a good diagnosis is also about being a good detective. A doctor needs to make sure that the symptoms aren't being caused by something else entirely, maybe a medication, substance use, or an underlying medical issue like an overactive thyroid.
Getting the diagnosis is one thing, but what's it actually like to live with GAD over the long haul?
Unlike some other anxiety disorders that can pop up in childhood, GAD often develops a little later in the life. The full-blown disorder typically shows up around age 30, which makes sense. It's often a time with a ton of new life and career pressures.
For most people, GAD is a chronic condition. As you can see on this timeline, its course tends to fluctuate. The symptoms can be worse at some times and a little milder at others. And even for people who have periods of recovery, relapse is pretty common. One study found that about half of those who got better eventually had a relapse.
Another huge challenge is that GAD rarely travels alone, and its most common partner is major depression. In fact, a staggering 62% of people who've had GAD also experience depression. And it really makes sense when you think about it. The constant mental and physical exhaustion from anxiety can so easily pave the way for the hopelessness that comes with depression.
And the long-term impacts can be really severe. GAD can cause major problems in daily life. Some studies found the impact on a person's ability to function was even worse than what's seen in major depression. And physically,
that chronic stress really adds up, leading to a higher risk of poor cardiovascular health, including things like high blood pressure and heart disease.
Okay, I know all of that sounds incredibly heavy, and it is, but the story absolutely does not end there. Let's talk about managing GAD and finding some relief.
I think this quote really just captures the experience perfectly. It's like you're carrying around this heavy backpack that you just can't ever seem to put down. Some days it might feel a little lighter than others, but that weight is always there, affecting your energy and just how you move through the world.
But here's the good news. Here is the hope. You can learn to lighten that load. There are proven treatments out there. Things like therapy, especially cognitive behavioral therapy, can help you change the thought patterns that fuel the worry. And for some people, medication can also help. Both can significantly reduce the weight of that backpack.
So, what can you do? Well, the first and most important step is just to talk to a doctor or a mental health professional. It's now recommended that all adults get screened for anxiety, so don't be afraid to ask about it. Seeking out good resources and support is absolutely key.
And I really want to leave you with this. GAD is a really tough condition, but it is not a life sentence. So many people recover, or they learn to manage their symptoms so well that they can live full, amazing lives. That backpack might always be there in some way, but it doesn't have to be so heavy. There is absolutely hope.